Hello everyone, welcome to my channel and thank you for tuning in today. Today we'll be talking about contraceptives. Previously we've talked about long reversible contraceptive and hormonal contraceptives. So today we will be looking at the barrier method. Now what is a barrier method? A barrier method of birth control acts as a barrier to keep sperm away from reaching the uterus. Some barrier methods also protect against sexually transmitted infections. There are a few types of barrier method, and they are namely Spermicide, Condom, Diaphra, Vaginal Cap, and Sponge. So we have 5 types of barrier methods. So and these 5 types of barrier method has its advantages and disadvantages, but it depends on what suits your body. Depending your discussion with your doctor, you decide which does suit you best. Now the first one is Spermicide. Spermicide is a barrier method. What it does is that it kills off any kind of sperm that comes into your body. So Spermicide can be used on its own, or it can be used with another barrier method. But one thing to know is that Spermicide cannot be used with Sponge, because Sponge already comes with its own Spermicide. When Spermicide is used on its own, Spermicide should be inserted into the vagina close to the cervix. You have different kinds of Spermicides, and you have like a gel Spermicide, you have like a foam, you have like a film Spermicide, and you have what they also called suppository Spermicide. I have not used Spermicide before. So when Spermicide is also used, you have to wait 10 to 15 minutes once it's inserted inside the vagina for it to take effect before you have sex. Because if you don't wait, then it will not be effective to stop the sperm or killing the sperm not to get to the uterus. So it's important that when Spermicide is inserted, give it 10 to 15 minutes before anything happens. And remember, once again, Spermicide is only effective 1 hour after it's inserted. So if you insert Spermicide and after 1 hour no action, then it's no longer effective. It will no longer kill off the sperm or stop you from getting pregnant. But always speak to your doctor. Advantage for Spermicide is that it's cheap. It's something you can easily pop into the shop and buy. It's something you can do yourself. You don't need a doctor to insert that or a nurse to insert that. So it's readily available. So that's the advantage. But the disadvantage is that it can be very irritable. Some women find that they react to it. Some women don't like it. So it depends on you. It depends on your body. Anyone that works for you. Barrier method is condom. A lot of us know what condom is. So condom stops or prevents the sperm from getting into the woman's uterus and fertilizing the egg. There are different kinds of condom. You have the male condom and also the female condom. The male condom provides the best protection against STIs, sexually transmitted infection. But condoms don't really give you that great protection against pregnancy, so take note of that. That's why sometimes some women will think, oh, but we used condom, I eventually fell pregnant, what happened? So condoms don't give you that 100% protection from pregnancy, but it can protect you against STIs, and it is rated quite high. That is why they encourage people to use 2 kinds of barrier methods. Say, for example, the Spermicide that can stop the sperm because it kills off the sperm from getting to the woman's uterus, then condoms as well that can stop you from getting STIs. The female condom, as you can see from the picture, can be inserted 8 hours before sex. You can have that done. You can insert that by yourself 8 hours before sex. Now, the advantages of condoms that it is cheap, easily accessible. It's something the woman, the man can use, and it's something that can protect you from STIs. But disadvantages is that because it's latest, some women find it very, very irritable and they react to the latest. So some women don't like it. Now the third one is the sponge. Sponge is a soft foam that a woman can use, but is only effective when it is wet. So if you wet the sponge, you can hold it at the tip and you can insert it into your vagina, where once it goes into the vagina, it expands and covers the cervix. And once this is done, the sponge stops any form of sperm from getting into your uterus. If you've just given birth and you want to use sponge, as a means of protecting yourself, from getting pregnant as a contraceptive, you are advised to wait for 6 weeks. That enables your uterus and the womb to go back to their normal size, to use sponge. But again, speak with your doctor, speak with your midwife, speak with your nurse. They will have suitable advice for you. Now, advantages of sponge. Sponge, like I said, with the condom, they are readily accessible. It's something that you can buy over the counter. It's cheap. It's something you can apply at home. You don't need the doctors. You don't need anybody to do that application for you. But disadvantages, again, it does not stop you from getting sexually transmitted disease. It can increase the risk of STI, sexually transmitted infection, and it can also increase the risk of HIV. Why do they say that? They say that if somebody you're sleeping with or your partner, whoever, is infected with HIV, that using a sponge increases the risk of you getting that from that person. And another negative point about sponge is that it can give you the toxic shock syndrome. Women have experienced toxic shock syndrome after they've used sponge. So again, speak to your doctor, my darlings. Just make sure you're using the right contraceptive that is good for you. Next point here is diaphragm. Diaphragm is a small device. It's like a dome shaped, as you can see from the picture, and is made from silicone that fits inside the vagina and cover the cervix. Diaphragm must be used definitely with spermicide. It does not have its own spermicide, so diaphragm must be used with the spermicide. There are two types of diaphragm, namely the individual size diaphragm. This individual size diaphragm means that the diaphragm is fitted, is unique to you. So this is done by the professional. You go to the doctor and they check you out and they decide which one suits you, which fits you, and that is fitted into you. And there is a general diaphragm, or what they call one size fits all diaphragm, that it's out there that everybody can use. That one, you can buy it from the shop, you can try using it yourself. But the fitted one, the individual fitted one, that has to be done by a doctor or a healthcare professional, that particular one, if anything changes in your body, for example, say you go on a surgery, or you put to bed, or you even add weight, or you lose weight, you've got to go back to the hospital and your doctor will check you out again and make sure that they're putting the right size. Because when you lose weight, when you give birth, when any major changes like surgery, the cervix and vagina may change. Well, I didn't know that. But yeah, that happens. So when you lose weight, when you gain weight, when you have a baby, I have that knowledge. But when you lose weight, or even when you undergo major surgery, your cervix and vagina may change. So that's why those fitted ones, individually fitted ones, they need to go back and they will check them, make sure that it's still the same size, or if they notice anything has changed, they will get them a different one. Advantages of diaphragm. So similar with the sponge, the diaphragm is something you can go to the shop, you can buy, then you can use. accessible, it's cheap, it's something you can easily get. But again, the diaphragm does not stop you from sexually transmitted disease. The diaphragm also increases the risk of you getting HIV, especially from somebody who's got it. And the diaphragm also gives the toxic shock syndrome. I'm not saying to every woman individually, what I may react to might not be what you will react to. So we are all different, but they are saying that women have complained about this toxic shock syndrome when using diaphragm. So the last one is the cervical cap. Cervical cap is a small plastic dome that fits tightly over the cervix, and it stays in the cervix there by suction. It also acts as a barrier to stop the sperm from getting to the uterus. Cervical cap also has to be used with spermicide. It's not like sponge. It does not come with its own spermicide. So if you're fitting in the cervical cap, then you will also have a spermicide that has to go with it. Cervical cap can only be prescribed by a healthcare professional. And not just prescribing it, it must also be fitted by a healthcare professional, because it's something that only a professional can do. So after insertion of this cap, the cap can remain in the cervix for 6 hours after sex. For 6 hours after sex. But it should not be left in the cervix for more than 48 hours. That is the strict instruction. So the good thing about the cervical cap is that it's not that expensive. It's something that a professional can come in and do for you, and it's there, and it does not have any interaction with your hormone. So it doesn't have any hormone effect in it. So some women are quite comfortable with it. They are okay with it, because oftentimes these medications that interact with our hormone, if you're a woman who has a hormonal imbalance, then you will now see that that's interacting and is affecting you, affecting your mood, affecting your behavior, affecting a lot of things in your life. So the advantages of this barrier method is that they don't interact with your hormone. That's one great thing about it. It's also easily accessible. Another advantage of it is that it can be inserted 40 hours before sex. So you can insert it, get everything ready, wait for the action. Don't mind me, So these are the advantages. But the disadvantage is that, like the diaphragm, you've got to always check for the wear and tear. Always checking to make sure that, is it okay? Is it safe? Is it clean? And all that, you've got to keep an eye on it. And like diaphragm as well, it can also give some women toxic shock syndrome. And above all as well, it does not protect you from the STIs or from even getting HIV. So these are the disadvantages. But when you look at the positives, if they outweigh the negative, it's your choice. You speak with your doctor, you decide which one to go for. Because what we want here is a happy woman, then a happy man, a happy family in general. Thank you for watching today. Our next episode regarding this contraceptive, I am going to talk about emergency contraceptive and non-reversible contraceptives. These are the last two topics on contraceptives. So don't forget to like, give your girl a thumbs up, and I'll see you soon. Thank you for tuning in today. I really appreciate you. Love you all, and thank you so much. See you.